Now we are going to discuss multiple sclerosis, which is an autoimmune disease in which abnormal response of body's immune system is directed against the central nervous system, which causes chronic inflammation, demyelination, which leads to decrease in nerve conduction velocity and early fatigue of nerve, lysis, which is proliferation or hypertrophy of several different types of lyses, which include astrocytes, microglia, or oligodendrocytes. It was first defined by Dr. Jean Charcot in 1868. The clinical or pathological characteristics are paralysis, intention damage, which is when patient is making or attempting a precise movement, scanning speech, in which there is a long pause between the syllables, nystagmus, which is repetitive and uncontrolled movement of eyeball. Later, these three terms are termed as Charcot's triad. Damage to myelin leads to symptomatic flare in MS, and these damage areas after do not fully recover, leading to areas of scarring, damage, and acute and chronic symptoms of MS, which in turn leads to significant disability and impaired quality of life. Genetic predisposition and environmental trigger affect the autoimmunity, which in turn leads to loss of myelin and nerve fiber. Early symptoms with which the patient presents are numbness and weakness in one or several limbs progressing from paresthesia, which is abnormal tingling or prickling sensation, visual disturbance in the form of double vision, atrophy of optic nerve, which is difficulty in eye movement, temporary vision loss, or impaired ocular movement. Fatigue is usually the early symptom with which the patient presents. The Hertz sign is when the patient is asked to flex his neck, which may induce a tingling or electrical shock like feeling down the neck and back. This is due to increase in sensitivity of demyelinated axon to stretch or pressure on the spinal cord, which is induced by neck flexors. While the Utho phenomena is worsening of neurological symptoms when the body gets overheated from the cold weather, exercise, or fever. The other symptoms with which the patient presents are pain in the form of headache, chronic neuropathic pain. Cognitive symptoms are short-term memory deficit, diminished altered concentration, depression, anxiety. Motor symptoms from the musculoskeletal system are spasticity, spasm, ataxia, impaired balance, coordination, and gait. Speech and swelling symptoms are dysarthria, which is difficulty in articulation of speech, dysphonia, disordered sound production, dysphagia, which is difficulty in swelling. Bladder and bowel symptoms are spastic and flaccid bladder, constipation, diarrhea, or incontinence. MS relapse and pseudo relapse. MS relapse is occurring of new symptoms or worsening of the old symptom which must last 24 hours or more or occur at least 30 days after the last flare-up, while the pseudo relapse is when the symptoms appear and then usually go within a 24-hour period. There are four different types of MS: relapsing remitting, secondary progressive, primary progressive, progressive relapsing. Relapsing remitting, in which there is episode of relapsing or remitting phases of the disease, while in the secondary progressive there is neurological deterioration with or without the relapsing episode of the disease. While in the primary progressive there is continuous neurological deterioration with having no relapsing or remitting episode of the disease, while the progressive relapsing disease in which there is a neurological deterioration with subsequent relapsing episode in between. We know that the course of MS is relapsing, remitting, or progressive in nature. The damage must be occurred in at least two separate areas of CNS at different times or in different locations with at least 1 month apart, or to make the diagnosis of MS. That is why the MS is sometimes termed as dissemination of near in space and time. Thank you.